Hi, my name is Michelle Priest. This is for Nurse 5130 Pediatric Assessment. This is my MAV ID. Here's a 360 scan of the room. Okay. All right. So I'm going to start by performing hand hygiene. Knock, knock. Introducing myself to the patient. Hi, my name is Michelle. I'm going to be the nurse practitioner today. Do you consent to having him in the video?
Yes.
Yes.
Okay, great.
I do.
And what's your name?
Jackson.
Jackson. And how old are you?
2015. 8.
8? Okay. And when's your birthday?
2015, January 2nd.
You're going to have to talk loudly and clearly for me.
Yes, ma'am.
What is your birthday?
January 2nd, 2015.
Awesome. And Jackson, where are you right now?
At a clinic.
And what year is it?
2023. Charlie?
Great. And how would you describe your mood right now?
Good.
Good? Okay. So Jackson here is a well-appearing 8-year-old boy in for a well visit. He appears his stated age. His reported mood matches his affect, which is good. He is well-groomed. He is able to communicate effectively and, look at me, maintains good eye contact when he speaks. So we'll go ahead and get started with this exam. I'm going to just do a comprehensive wellness exam on you, okay? I'm going to start with some inspection. Oh, and I also forgot to show my tools over here. There we go. Okay. Start with inspection. So I'm going to look at his skin, and I can see that his skin is tan and no hypopigmentation, no lesions, no scars, no piercings. He doesn't have any apparent wounds. I'm going to palpate the skin to assess for temperature, which it's warm, it's dry.
You're right.
Am I warm? I'm gonna check skin turgor, and it has instant recoil. I'm gonna look at the nail beds and see that they are at 160 degree bilaterally, and then I'm gonna check capillary refill. Can you hold still for me? Capillary refill is less than 2 seconds. In the fingers, okay, try and hold still for me. And then we're gonna go to the toes. We're gonna check capillary refill, less than 2 seconds. And check the other side, might tickle a little bit. Less than 2 seconds bilaterally. Great, so now I'm going to look at his hair. It is black and evenly distributed. I don't see any hair loss, no infestations. I'm gonna just feel your head real quick. I don't feel any masses. I don't see any lesions or irregularities. Now I'm gonna look at his face. Okay, so for this, his head is normocephalic, round. His facial features are symmetrical bilaterally. So I am going to also look at his throat here for any fullness, which is negative. Can you swallow for me? Okay, his thyroid moves up when he swallows, and his trachea is midline. I'm just gonna touch here for any masses. Don't feel any masses on his thyroid, it's smooth. And then I'm gonna check his carotid arteries one at a time. And they are 2+ bilaterally. Then I'm gonna take my stethoscope quickly here and listen with the bell for any murmurs or bruits, or any bruits, not murmurs. No bruits present in the thyroid or the carotids bilaterally. Thyroid. Okay, great. And regular rate and rhythm in the carotids bilaterally. Now I'm going to assess the facial nerve which is cranial nerve 7, which is a sensory and motor nerve. So for this one, I'm going to ask you some silly questions. So I'm going to have you start by smiling. Okay, now show your teeth. Great. Now frown. Frown. Good. Now wrinkle your forehead. Good. Now raise your eyebrows. Good. Okay. Now I'm going to have you, I'm going to close your eyes. Now try and close your eyes and open your eyes. Close against resistance. Okay, good. Now I'm going to have you puff out your cheeks like this. And now purse your lips. Good. And can you tell the difference between eating something salty and eating something sweet?
Yes.
Okay, so the anterior 2/3 of his tongue, he can differentiate between salty and sweet. So facial nerve is intact, and then I am also going to assess trigeminal nerve, which is cranial nerve 5. So for this, I am going to have you go ahead and bite down for me, just like you're chewing something. And I'm assessing the temporal and the masseters, that they contract bilaterally, which they do. So that's intact for the motor portion. And then, thank you. I'm going to grab my object here. Let's use this. And we're going to do sharp and dull sensation. So this is going to be sharp and dull. Okay. So we're going to assess the sensory of trigeminal. I'm going to just check on your face. Just look straight ahead for me. Tell me when it's sharp and dull.
Sharp. Dull. Sharp. Dull.
Good. Okay, so motor function is
Sharp,
intact.
dull, sharp, dull.
Good. Thank you.
Good job.
All right, so now I'm going to go ahead and assess the lymph nodes here, so you can just state how you are. Gonna assess for any swelling, so I'm gonna, any tenderness or swelling. So I'm going to palpate the occipital, the postauricular, maybe we should sit like this a little bit. There we go. Postauricular bilaterally, preauricular, no, that's good, that's good. That's good. Preauricular, submandibular, submental. Okay, I'm gonna have you just look forward and slightly tilt your head down. I hope it can see. Maybe we should scoot that forward a little bit. Stand up for me real quick. Okay, come sit here. Look down again. Anterior cervical, you can sort of tilt to the side. Posterior cervical. Supraclavicular. This one might tickle a little bit. I'm gonna check your axillary. I'm gonna check on the other side, underneath the shirt. Good. Epitrochlear and epitrochlear. Okay. And no tenderness, that didn't hurt at all?
No.
Okay, no tenderness or masses present for that assessment. All right, great. I'm gonna scoot you just here again. That's good right there. Okay, so I'm gonna move on now to assess the eyes. So I'm gonna start by inspecting your eyes. And for this portion, I'm going to put on some gloves.
Okay.
So looking at the gloves, so looking at the eyes, they are symmetrical. The eyebrows and eyelashes have even distribution. I'm going to look right now, I'm going to palpate your conjunctiva, which is pink and moist. I'm going to feel the eyeballs, which are firm. Okay, I'm going to look again. Sclera is white, the lens is clear, the iris is brown, pupils are black, and close for me again. Yeah, the lacrimal apparatus is soft and free of exudate and edema. Now for the rest of this test, I would also assess optic nerve, which is cranial nerve 2, which is going to be sensory. And for this test, I would use the Snellen to assess far-sighted vision. I would hold the Snellen chart at 20 feet from the patient and have him cover one eye at a time without corrective lenses and read the smallest line that he could. And then I would have him repeat this without covering either of his eyes. And for perfect vision, I would score him as a 20/20 on the OD for right eye, 20/20 OS for left eye, and 20/20 OU for both eyes. And for nearsighted vision, I would use the Rosenbaum chart at 14 inches from his face. I would check nearsighted vision with this, and we would do the same test of covering one eye at a time and then covering both eyes to score him the same for this. And okay, thank you. All right, so now I'm going to grab my pen light and going to assess your pupils. So his pupils are gonna be 3s bilaterally, okay? I'm going to check for consensual reaction to light. Good. Okay, I'm going to take my otoscope now and perform my otoscopic exam. So for this, let's see if this is shining. Okay, it's not very bright. There we go. Okay, I'm going to do right eye to right eye. Here, we can sit kind of at an angle here. And I'm going to focus and move in. And there is a red reflex. Retina is red. The optic disc is has appropriate margins, okay? And I don't see any hemorrhages. I'm gonna do the other side. Focus and move in. Okay, open your eye for me. I know it's really bright. Okay, red reflex is equal bilaterally. Sorry. Okay, and all right, so now moving on, we are going to assess cranial nerves 3, 4, and 6, which is going to be our oculomotor. These are going to be motor nerves. So we're going to be checking oculomotor, our trochlear, and abducens. So for this, I'm going to start by assessing here. Get my pen light again. Consensual response. So I'm going to start by covering the right eye and checking the right eye for any deviations. Covering it again, checking the left eye for any deviations, and none are noted. We're going to do the same thing on the left eye, check the left eye, cover left eye again, and check the right eye, and no deviations were noted. And I believe I already assessed that pupils are equal and reactive to light, but let's just assess that again, just in case I missed that. Great. And now I'm going to assess the 6 cardinal fields. So for this portion, I'm going to have you look at my pen light and follow it with just your eyes, okay? No nystagmus or lag is present. Good, one more. Good, okay.
those are the things.
Okay, well, moving on. All right, now let me grab my here. All right, now I'm gonna move on to your ears.
Okay.
Well, so I'm gonna grab another one. All right, so I'm going to inspect the ears to start. The pinna has no redness or swelling. I'm gonna palpate, okay, the pinna to the earlobe for any tenderness, any pain when I do this.
No.
We're gonna do this bilaterally to the other side. Any pain?
No.
Okay, great. Now I'm going to look into your ear. We're starting with let's start with the right side. So let's face this way. Okay, I'm gonna brace the otoscope, pull the pinna up and back. We're bracing, and we're looking in. The ear canal is pink. There's no edema or erythema, no obstructions or perforations. The cone of light is at 5 o'clock, and the tympanic membrane is pearly gray. Great. And now we're gonna do the same thing on the other side. You ready? So, I'm going to brace the otoscope, pull the pinna up and back. All right, the ear canal is pink, and I don't see any edema or lesions or perforations, obstructions. The cone of light is at 7 o'clock on the left side, and the tympanic membrane is pearly gray. Great. Now we are going to test cranial nerve 8, which is the stibulocochlear, and to test hearing acuity for this exam. So I'm going to stand behind you at 2 feet. I'm going to say 2 words, and you're going to tell me what I said, okay?
Okay.
I'm going to whisper them. You can keep this ear uncovered. Apple pie.
Apple pie.
Good. Pretty Maple.
Pretty Mabel.
Okay, good. So that is intact, and that's sensory.
It's a weird word.
All right.
Mabel.
It is. Okay, so now we're gonna move on to the nares here, the nose. So the nose is midline, it's symmetrical. You don't have to do that. I'll start by palpating your sinuses here. Tell me if there's any pain or tenderness. The maxillary or frontal, any pain?
No.
I should really be just putting some pressure.
Touch my eye.
Sorry about that. No pain?
No.
Okay. And then I'm going to transilluminate the maxillary sinuses. Open your mouth for me. And I see redness, so there's no obstruction. Redness, no obstruction. Great. Okay. And then I'm going to look inside of your nose here. So I'm going to tilt your head up. Okay. I'm going to brace the otoscope, and the nasal passageways are pink. The canals are pink. No.
Let's turn this way. So I can see. Because if it was like that.
Can it not see you? Okay. All right. So nasal passageways are pink. No obstructions. No exudates. No erythema on either side. And septum is midline. Can you occlude one nose, or can you cover one side and breathe in and out? Okay, and I'll take that finger down and do it to the other side. Good. And the nasal passageways are unobstructed. So that's over here. Actually, you know what? We'll use this again for the next, or let's use this one. All right, and now I'm gonna check your mouth. Let me put on some gloves again. Okay. Oh, you can't whisper to me in the middle of it, baby. Okay,
are you doing?
You can, if you have to ask the question, you have to ask it loudly.
When are you gonna do the gagging test?
Oh, I won't really do the gagging test, so I'm just gonna speak it out. Okay. Hopefully that doesn't count against me, but I mean, okay. All right, so let's go ahead and first inspect. So the lips are pink and moist. I'm going to now palpate your lips. Okay, no mass is present, no lesions. Open your mouth for me, say ah. All of his teeth are intact, no dental caries. Tongue is dull and red. I'm gonna shine a light now inside. I would palpate his buccal mucosa and the gums, but I'm going to just shine a light throughout. Can you stick out your tongue and say ah for me? Good, okay. So I'm now assessing cranial nerves 9 and 10, hypoglossal and vagus. So these are going to be motor cranial nerves. And I'm assessing that the uvula and the tonsils raise, or the uvula and the soft palate raise symmetrically when he says ah, okay? And then I would assess his gag reflex for the vagus, and he has a positive gag reflex, so those are intact. Tonsils are +1 out of +4. All right, let me put this back.
I'm so tired.
Okay, so now, take off my gloves. We're going to assess the, and those are also sensory. So can you differentiate the difference between bitter and sour tastes
Yes.
on the posterior third of your tongue?
Yes.
Okay, so that is also intact. Great. All right, so you can sit for me. Now I'm going to just put both your feet on the ground. I'm going to assess the cranial nerves 11 and 12. So for this, I'm going to be checking spinal accessory and hypoglossal. I'm just making sure. So I said glossopharyngeal and vagus on the last one. I just wanted to make sure I said that correctly. All right, so for this, I'm gonna have you raise your trapezius against resistance. Good, muscles are equal strength bilaterally. And then I'm gonna have you turn your head to one side and try and turn it back against resistance. Good, and the sternocleidomastoid muscles are strong bilaterally. Okay, great. And then, I do need gloves again.
You need so many gloves.
I am going to have you stick out
Keep
your
the
tongue.
Just keep the gloves on.
Okay, yeah, let me just finish this. Okay, stick out your tongue and move it back and forth against the resistance. Try and push it against my fingers. Okay, good. That is intact as well. All right, so now we're gonna move on to chest. So I'm gonna start with inspection. So the AP to transverse diameter is 1 to 2. And can you sit still for me real quick? Respirations are equal and unlabored. I would count respirations for 1 full minute here, and say his respirations of 16 are regular. And then I grab my stethoscope. I'll come on this side. This is probably the best way to do it. So I'm going to start by listening to bronchial sounds over your trachea and larynx. Okay, just sit normal for me. Take a breath. Okay, good. And I'm going to listen to bronchovesicular sounds over the second intercostal space. Oh, you know what? Here, I'm gonna listen. Can we take off your shirt for this part, or we'll just lift it up like this? Here we go. Bronchovesicular sounds, where E is greater than I in these areas. We're gonna listen to bronchovesicular or vesicular sounds for one full inspiration in and expiration. Inspiration, expiration, inspiration, expiration. And listen to your lateral lung sounds here. Breath in and breath out. Here, can you sit up straight for me? There you go. Okay, now I'm gonna have you turn around and face the opposite direction.
Right.
And you can just swing your legs over that way.
Like this?
Yes, that's good. A little more. So your back is to the camera. Okay. And listen again. For vesicular sounds over the posterior lung fields, deep breath in and out. Breath in and out. Breath in and out. Breath in and out. In and out. And his lung sounds are clear to auscultation bilateral, no adventitious lung sounds. Now we're going to move on to the cardiac assessment. No thrills, bruits, or pulsations. I would check for that, and none are present. I'm going to now go ahead and palpate the pericardium. And I'm going to palpate the apical pulse for a full minute. Okay, hold still for me real quick here. Check his pulse. What? I'm scared. Okay, so we'll say he has a rate of 67. All right, now I'm going to do your cardiac assessment. I would do in a sitting, supine, and left lateral recumbent position. I would listen with the diaphragm for high-pitched sounds, and I would listen with the bell for low-pitched sounds such as murmurs. So I'm going to go ahead and start here. Lift up your shirt again. All right, at the right second intercostal space, I'm going to listen to the aortic, mid-clavicular line, or right sternal border. Second intercostal space, left sternal border at the pulmonic. Erb's point. Jackson, don't do that, please. At the third intercostal space, third intercostal space, left sternal border. Tricuspid at the fourth intercostal space, left lower sternal border. Mitral at the fifth intercostal space, mid-clavicular line. And then I would listen at the apical pulse, again, for any bruits, murmurs. and that's at the 5th intercostal space, mid-clavicular line, point of maximal intensity. And also to mention, S1 is going to be greater than S2 at the aortic and pulmonic at Erb's point. S1 is going to be equal to S2, and at the tricuspid and mitral, S1 is going to be greater than S2. Did I say S2 greater than S1? S2 greater than S1. S2 and S1 are equal, and then S1 is greater than S2. S1 is greater than S2 on the tricuspid and mitral. I think I got those flipped around on the first time I said it. All right. So now we are going to assess your, over here, pulses. I'm going to start with your temporal pulses. They're +2 bilaterally, +2 out of +4. We're going to check your brachial, +2 bilaterally, your radial. Oh, I don't know if they could see that. Here. Brachial. Radial. Could you visualize what I was doing when I was doing the cardiac assessment? Okay. And then we're going to check the posterior tibial. Here, can we scoot this back a little bit? There we go. Okay. Posterior tibial. The same on this side, both +2, and the pedal here, +2 and +2. Great. All right, now we are going to move on to the abdomen. So for this assessment, I'm going to have you lay on your stomach or on your back and put your knees up so your knees are bent. Okay. Okay, well, that should work. All right, I'm going to start with inspection. So I am inspecting, I'm going to take a peek at the skin. It is tan colored, no lesions or scarring or wounds present. It is rounded, and I'm just going to have you keep your hands by your side for this portion. And I'm going to start with auscultation first before I do any percussion or palpating. So I'm going to start by listening to the right upper quadrant, and there's normal active bowel sounds. Left upper quadrant, normal active bowel sounds. Left lower quadrant, normal active bowel sounds, and right lower quadrant, normal active bowel sounds. I'm also going to listen with my bell to the gastric bubble. I wonder if you should hold the camera so that we can see. Can you tilt a little bit there? There we go. I would have him lying on his back, but for the purpose of seeing this, I listen for normal active bowel sounds in the right upper, left lower, right lower, and the epigastric bubble for any bruits. And I am now going to press. You can stay like that. I would have him lying on his back. This is just to be able to visualize it. So I'm going to start in the right upper quadrant. I should hear tympani across all fields, or bowel fields, and then at the 5th intercostal space, mid-clavicular line, I should hear liver dullness, spanning 7.5 centimeters, and then on the left side, you can now lay flat again. 6th to 10th intercostal space, I should hear splenic dullness on the mid-axillary line. Then I'm going to do palpation, start with light palpation. Through all 4 quadrants, no swelling or tenderness present. Then I'm gonna do deep palpation, no hepatomegaly, no swelling, masses, or tenderness noted. All right, now I'm gonna have you sit up for me and face your back to the camera. So turn the other way. We're gonna check for CVA tenderness. Sit up for me and put your legs on this side. There we go, perfect. I'm going to do fist percussion. Sit up straight. I'm gonna check at the flank. Here. That's not staying up, is it? Any tenderness?
No.
So negative CVA tenderness. All right, and then you can go ahead and turn back around. We're gonna move on to your musculoskeletal assessment here. So we'll go ahead and we'll start by standing. And I'm gonna have you stand right here. There we go, and walk towards me. His gait is even and steady. He walks smoothly. Come back this way. I'm gonna have you stand like this with your legs straight. His hips are midline, his shoulders are even and midline. Okay, great, you can turn back this way. Posture is erect. Now I'm going to ensure that he does not have scoliosis, so I'm gonna have you keep your legs straight like that, and then I'm gonna have you reach forward with your arms and touch your toes. I'm gonna look at the curvature of his spine. Stay like that for me. I'm checking from all angles to make sure that there is no abnormal curvature to his spine. Stay for just 1 more minute. And come up really slowly for me. Good. Okay, no curvature to his spine, so he does not have scoliosis. And then for this next portion, I'm gonna check range of motion. So I'm gonna have you extend or flexion and hyperextension of your neck. So bend forward and then bring your head back. Good. All right, and then I'm gonna have you do arm circles with both of your arms. You can face the camera like this. Step back a little bit. Okay, full circles for his shoulder mobility. Good. And then I'm gonna have you put your arms out, push down on my hands. Okay, hands up, push up on my hands. Good. In, push in on my hands. And now turn them this way, your hands this way, push out. Okay, full mobility on his hands. I'm gonna have you flex, and extend your wrists. Good, circles. Okay, and then I'll have you, let's just get rid of this now. I don't think I need this anymore. Let's switch to the chair. Okay, you can have a seat there, and then let's do the same with your feet. I'm gonna have you flex, or extend and flex, extend and flex. Same on this side, extend, flex, extend and flex, and do circles with your ankles. Okay, so he's got full range of motion and equal mobility in all of his extremities. Great, so now I'm going to move on to, we assess the cranial nerves throughout our comprehensive assessment. I'm just going to assess coordination now. So for this one, I'm gonna have you put your arms out like this with your pointer fingers out, and I'm gonna have you touch your nose one at a time. Back and forth.
Like this?
Mm-hmm. Good, and then we're gonna do rapid rhythmic movements. So for this, you can stop doing that, you did great. I'm gonna have you go like this with your hands, and then clap. Good, all right, great. And now, so that is intact. Now for the sensory portion of this, I'm going to have you identify in your upper and lower extremities. Get this again. Where's here it is. We'll do dull and sharp sensations. So when you feel a sharp sensation, can you feel this?
Sharp.
Can you feel this?
Yeah.
What is this?
Dull.
Dull? Or we'll do this for dull. Okay, so tell me when you feel sharp or dull.
Sharp. Dull. Sharp. Dull.
Good, okay. All right, and now, I know, Charlie's licking his crate. We are going to do, we did sensory, we did Jackson's distracting you.
Are we gonna do
Don't suggest anything else. Don't suggest anything else. Sensory motor. Okay, well, we're gonna move on to deep tendon reflexes. So for this, I am going to start by assessing your brachial or your bicep reflex. Okay, and we'll do this side. Don't do it. Okay, and now your brachioradialis. Don't try to relax. Try to relax this arm.
Okay.
No, that's not relaxed. Just relax it, please. Okay, we're gonna start with this one then. Let's try and just make it floppy, like straight arm. Like, not straight arm, I mean, just loose. Like if I was going like this. Don't flex anything, just relax. There we go.
Why are you moving it up?
Okay, and now I'm going to assess your tricep. So for this, you're gonna have a loose arm, okay? Loose.
Why do you keep pushing it up?
Relax, just relax it. Okay. Now we're gonna check your patellar. Scoot all the way back in your chair for me. Okay, and relax your legs, just let them dangle free. Okay, we're checking the patellar. And would elicit that response. Now we're gonna do this side. There we go. We're really gonna get a good one. Okay, and now we're gonna check the Achilles. So that's gonna be my dog is scraping in his. Got him next to us in the crate, Charlie. I would assess the Achilles.
Jax.
Charlie. Can you just handle that for me? No, not you. Come on. All right, for the Achilles. Can you see here? I'm gonna have to move the camera down. I would be assessing the Achilles and then on this side as well. And then I would check the Babinski. So for this one, I would check for fanning out of the toes instead of curving in. Curving in would be a negative Babinski. Fanning of the toes would be a positive Babinski. Okay. And that concludes my comprehensive assessment. Thank you for participating.
Woo!